We're getting started here today with a Compass MS Care program. So our sponsors for the program is EMD Serono, Genentech, Novartis, Sanofi, and TG Therapeutics. Let's give them a round of applause, please. I ask for that because we can't do these programs possibly without the sponsorship of these pharmaceutical organizations to help us to be able to provide this for people to learn around the United States. All right, so today we also had exhibitors from Alexion and Biogen, EMD Serono, Genentech. We had the National MS Society who partners with us to do these programs. We also had Mallinckrodt, Novartis, TG Therapeutics, Vanda Pharmaceuticals. If you don't know Vanda, we hope you had a chance to meet this newer pharmaceutical. And of course, our check-in table. We got Dr. Gretchen, come on up.
Thank you. Yes, thank you for having me. I'm so excited. Thanks to everyone at MS Visa News, all the sponsors. So we are going to be doing some exercises today. Hopefully you don't have to choose between lunch and exercise because I feel like I know what you'll choose. All right, so our main topic today is going to be about managing MS symptoms and how to manage your exercise routine during seasonal changes, temperature changes, and I specifically chose that topic because, well, it's June now, and when I chose a topic, I was like, it could be hit or miss. It could be raining and cold right now in this area, or it could be hot and warm, which it is hot and warm, but you never know in this area, and I find the majority of patients with MS that I work with hit these moments when it's too hot or too cold, even if they're in air conditioning when it's hot outside, or during seasonal changes where they just don't exercise or their symptoms are flaring. And it's so important that you feel empowered and motivated on those days as well, because we get a lot of those around here. So we're going to cover why symptoms can shift with those seasonal changes and temperature changes, how to adapt your exercise routine when it's too cold or too hot, and honestly, you'll also be able to use these tips and tricks any day. Even if your fatigue is flaring one day, these will work for then too. Strategies for fatigue, just when your body's like, no, I just can't today. And then quick wins to help you move more and feel better starting this week. Okay, so I've got some participation questions for you just so I can get a feel of where you guys are at. So raise your hand if you felt more tired, weak, or stiff in extreme heat or extreme cold. I'm glad you guys are here. If no one raised their hands, you probably wouldn't like this presentation much, but great. Raise your hand again. This question isn't up here, but raise your hand again if you feel more tired, weak, or stiff when it's hot outside, even if you're inside in air conditioning. Is that true for anyone? Yes, right? So many people are like, why is this happening? It's cool right now, but we're going to cover that. Okay. Raise your hand if you've ever skipped exercise because the weather made it harder. You're all in the right place. Awesome. And last but not least, raise your hand if you're unsure how to adjust when the seasons are changing or temperatures change. If your plan is just, well, I'm not going to do anything today, your hand would be up. Okay. All right. You're all in the right place. I'm glad you're here. Okay. So how seasonal changes affect MS. We're going to go into a little bit of the science of why this happens. I'm someone who needs to know the why in order to be motivated to do something else. And then we're going to get into exercises and strategies and things that'll be helpful for you. So our nerve conduction slows when there's too much heat or too much cold. And too much is subjective. I don't know about you guys, but I have patients where even if the temperature changes by 5 degrees, they feel it. I have other patients where it could change by 30 degrees and they're fine, but 35, and that's too much, whether it's hot or cold. Either one, nerve conduction slows down. And not only that, but research shows that a change in your core temperature by even just 1/4 of a degree up to 1/2 of a degree is enough to make any of your symptoms flare. And this is what's normally called as Otoff's phenomenon. 1/4 of a degree, that's so little. And we're talking today about temperature outside, but your core temperature can raise or lower based on so many things, like exercise can increase your core temperature, stress can increase your core temperature. Who feels worse after a hot shower? That's your core temperature. So anything that we're covering today, it's not just temperature outside, it's your core temperature. Additionally, hot temperatures, cold, or seasonal fluctuations, even if you're someone who does better in the cold, if it was warm yesterday, so like if this was fall time right now, going from warm to cold, you'd normally think, oh, this is going to be a great day for me because it's cold. But if it's a seasonal change like that, oftentimes that can cause symptoms to flare, any of your symptoms, even if it never used to bother you. And this is kind of a harsh reality about MS, but it's constantly changing. I can't tell you how many times I had a patient come to me and it was a hot day and they weren't doing well and they didn't know why. We start talking about heat intolerance and they were like, I don't have heat intolerance. And we had to have a discussion like, well, maybe you didn't used to in your 30 plus years with MS, but now it is a symptom that's bothering you. So just stay curious. Oh. This is a little confusing. It was supposed to be 2 charts, but that's okay. So how seasonal changes affect MS can be different in hot weather versus cold weather. So originally, I had each of these either under hot or cold, but I actually kind of like this better because the reality is any symptom can worsen with either. So things like fatigue spiking, muscle tightness, cog fog, stiffness, heat sensitivity, spasticity, weakness in legs, more noticeable vision changes, drop foot, joint pain, anything. And what that often features or presents as is tripping more. I'm going to use this since the slide looks funny. Tripping more, slower walking speed, needing more rest, and difficulty starting movement, just to name a few. Most times it's those daily movements that get you thinking like, oh, this isn't my best day today. So why do these symptoms, including fatigue, because that tends to be one of the biggest ones, why do they worsen? We already mentioned that during heat or cold or these seasonal changes, our nerve conduction slowers. And when that happens, our body has to work harder. It's harder for your leg to lift when your nerves aren't working as well. So in order for you to lift your leg to take that step forward, your body is working so much harder, which can make fatigue worse. It can make any of your symptoms worse. MS has less efficient energy systems anyways. Then we add in heat or a cold or those seasonal changes, and it just makes it even worse. Mental tasks plus physical tasks is double the fatigue. Raise your hand if you have difficulty not just walking, but walking and talking to someone, or walking and turning your head. Yeah? Yeah. Okay, so that's cognitive or mental and physical. Again, double the fatigue. That's a double whammy. And then overheating or overexerting can trigger flare-ups. I think we all know that. But one main reason for that is the core temperature increasing. What these changes and worsened symptoms don't mean. Sometimes when we feel these worsened symptoms, we assume a lot of things that are not true, and it's important for you to know that. Worsened symptoms from the heat or from the cold does not mean that your MS is progressing. It can feel that way. So if you're thinking that, it's a valid thought, but it's not true. It also doesn't mean that you need to push through and push harder. It doesn't mean that you've lost progress if you feel worse during these times. And it doesn't mean that anything you have lost is lost forever. It does mean that these changes are temporary, and it does mean that your body just needs a different plan, not necessarily for you to push through, put more effort in. And more often than not, we'll either just not do anything during these moments or push through and try to push harder. It's fine. I can do it. I'm still going to go out, still going to try to do my exercises like I normally do. And that's not what this means. So when it comes to MS, we have some great physical therapy in this area with MS specialists and MS-specific physical therapy, MS-specific exercise is very different from traditional physical therapy or orthopedic physical therapy, as Dr. Gutman and I were just talking about. Hands up if you've been to a physical therapist that was MS-specific. Yay. Oh, I love seeing that. Okay, so maybe half of people. So there's something that's really important for you to know. There's two main types of exercise. One is regular or traditional or orthopedic, and this tends to focus mostly on muscle. Whereas the second, that should be a number 2, the second is MS-specific or functional exercise. And this focuses on your muscles, but also on your brain and your neural pathways. And for MS, we do need both of these. There's a time and place for both. But it's really important to know what needs to happen in order for your muscles to move. Whether it's hot, whether it's cold, whether the seasons are changing, regardless, this sequence is what needs to happen. So we're going to review that. The first thing that needs to happen is your brain needs to activate. If I want to lift my leg, to take a step forward, my brain first has to have that thought of, okay, Dr. Gretchen, lift my leg. Or it needs to be a reflex, like I stepped on something sharp or hot, and it's reflexively has to lift. Then it doesn't just go from your brain to your muscle. The next thing, once the brain says, okay, lift your leg, then it needs to travel down a ton of neural pathways. So my brain says, lift my leg, and then that message is sent down all these neural pathways until it gets to my hip. And then, don't you, I love this graphic. So you're the Hulk in this situation. So then your muscle moves. And that's the pathway. It has to go through all three things. Now with MS is a neurological condition. It's the nerves that are affected due to demyelination. So oftentimes that's why traditional or orthopedic exercises, which focus just on the muscles, won't yield the same type of results because you're not focusing on the area where the issue is, which is the neural pathways. So there's a way to exercise, and we're going to do a bunch in a bit, to activate these neural pathways. And then once we activate these neural pathways, then your muscles will get strong. So with that in mind, before we get to practicing the exercises, I wanted to give you a few ideas, and because today is hot, again, it's hit or miss up here. I wasn't sure what today was going to bring, so we've got one slide for hot and then one slide for cold. So in the hot weather, here's some tips for you when you're exercising. Number 1, you can exercise in the earlier morning. If you're a night owl, less common in MS, but exercising at night could be an option too. Just choosing options when it's not as hot. Again, even if you're inside in air conditioning, that barometric pressure can affect you the same whether you're outside or inside. So choose a time of day where that barometric pressure might be lower. Number 2, fans or cooling vests. One brand of cooling vests that I like is the Thermapparel. Have you heard of them? They're actually a local company. It's Rochester based. And this is not an ad for them, so I won't go into why I love them. But Thermapparel is a very lightweight vest that you can wear under your clothes. So I like that because you can wear it out and about and no one would know that you're wearing it. You can wear it while you're exercising, just as you're watching TV. It doesn't matter, but keeping yourself cool. There's neck fans that I really like. I have one that I just got on Amazon, but keeping yourself cool while you're moving, but even before you move and after you move, Seated exercises, we're going to try some. I feel like I keep teasing that, but we truly will be trying them soon. Prioritizing form and quality over intensity. Do we even need type A people in this room? The type A people shot their arms up super fast. Yes. Okay. So especially for you, if you're one of those people, don't push yourself. Don't try to go for high intensity. These are the moments where it gives you an opportunity to focus on form and go slower and focusing on the quality. You can gain just as much progress from that as the days that you are pushing yourself a little bit more intense. And then sipping cold water before, during, and after. Being proactive. If you look at your forecast for the week and you see it's going to be warm or it's going to be cold and that's different than what it was today, plan as soon as you get up, start sipping cold water. Just get ahead of it. In the cold weather, you could use all of those techniques as well, but here's some additional ones. Gentle warm-ups, and we're actually going to do some of these warm-ups together, but warming up your body throughout the day. So this is something when we review it, it takes 30 seconds. You could do it every hour or 3 times a day, whatever works for you, but keeping your body moving because the goal is increasing your core temperature. Using heat packs before you move, again, being proactive, adding movement breaks throughout the day. That kind of goes in line with our first one of doing those warm-ups frequently. Layer up, but avoid overheating. I have had a good amount of patients overheat and therefore have heat intolerance in the winter because they are so bundled. So bundling is great, but you do have to be mindful of not over bundling. Layers is great because then you can take things off. And then this is the complete opposite of the previous slide. Sip warm liquids before, during, and after. What type of exercise is best to prioritize during these seasonal changes or temperature changes? And one that I should have put first is whatever you can do. If you can do something and you know that that something is something you can do consistently during these changes, that's first. But if you don't know, here's some ideas for you. Seated leg strengthening. These are going to be most of what we practice together. Seated or standing balance work. And balance work could just be, this is one of my favorites, weight shifting. You're just standing and shift your weight to the right and then shift your weight to the left. You could do the same thing, but in staggered stance. So you're just shifting your weight. You could do that seated as well. So you're just shifting your weight side to side. You could go around. I call this one around the world. So lots of seated exercises are doable, especially on these days where you're not feeling your best. Core activation, one of my favorite core exercises, you actually could do it now. You're sitting at the edge of your chair and you're just going to hinge backwards. It's kind of like a crunch in a chair and then pull yourself back up. So these are the types of, great job. These are the types of exercises we're talking about on these days where your normal routine might not be doable for you. High reps, low intensity. We already talked about low intensity, but we still want to shoot for high number of repetitions. High number of repetitions is how your brain is going to strengthen those neural pathways or find a brand new neural pathway from point A to point B. Point B meaning whichever muscle you're trying to strengthen. And then lastly, functional movement is always going to beat traditional exercise. Functional movement means the things you do throughout the day. So walking, stair climbing, getting in and out of bed, standing up from the toilet, sitting down on the toilet, all of that counts as exercise and movement. Okay, so we're gonna try some exercises if you're open to it. So here's how it's gonna work. All of these exercises are seated, mainly because those are my favorite types of exercises to do during these seasonal changes, but also you're eating and you can scoot back and it'll be easiest for you to participate. So I'm gonna show you what exercise to do on this chair, and then you're going to do it. To modify, if any of the exercises feel too hard, I have a slide in a bit here of how to modify in just different ways, but for right now, just aim for less movement. And I'm gonna try to get off on my soapbox right now, but just because an exercise is hard or maybe even impossible, like if one of the exercises is lifting your leg, if you have a leg that doesn't lift, that doesn't mean that it never will lift. Neuroplasticity is the ability of your brain to find a way to strengthen that specific movement. But the only way to strengthen that movement is through repetition and trying, even if there's zero movement. So for now, when we're talking about modification, just aim for less movement and think of success with an exercise as the amount of effort you're putting in, not the amount of movement that you're seeing. Just a disclaimer, these should be hard. If they're hard, that is a huge green flag, a huge sign that this is something that you should do consistently because it will target the specific muscle groups that you are having weakness in. If they're hard, that means it's an exercise that is worth doing. If you have zero movement, it doesn't mean it's not a good exercise. Keep trying. Your muscles can get stronger, as we just discussed, and focus on effort, not the amount of movement. So if you're open to it, this is our exercise time starting now. So you can, if you need to, you can kind of scoot back. You won't need a whole ton of space. So this first exercise is called marching. We're going to do it sitting. I like to show this one from the side because you can see more movement. Okay, so for this exercise, you're going to be in about the middle of your chair. I'll show you the harder version first. It's sitting up tall. That is the hardest version. If you want to try that, you're just going to lift one leg up and down. If you can, you're keeping your core muscles tight while you're doing this exercise. Again, this is the hardest version. So if you want to try an easier, it's not easy, but easier, you're going to recline back. You should feel nice and cozy. And same thing, keep your core muscles tight and try to lift and lower. There's no desired amount of lift. Any movement is a good amount of movement. So this exercise, you guys keep going if you can. This is strengthening our hip flexors, and you'll see I wrote at the top there, it's great if you have difficulty lifting your leg up. This standing version of this exercise, which you could hold on to something, would be lift, lift. Now this might look a little bit more accurate to what you'd think that you'd need for moving, because any of these variations, the seated or the standing or seated reclined, is going to help you with daily activities like lifting to step up on a step, lifting to bring your leg forward, to step up on a curb, to get out of your car. Anytime you have to lift your leg, you need to practice lifting your leg. That's what I mean by a functional exercise. We're not just looking for general strength. We want the strength for specific movements. Okay, that's the first exercise. Next one is toe lifts. Does anyone have foot drop that you're aware of? Okay. So foot drop is if, it actually has so many different ways it can present, but generally speaking, when you move forward, your toes might drag. You might look at your shoes. I'm looking at all your shoes. You might look at your shoes and see scuff marks on the very front, specifically of one foot more than the other, or maybe it's equal. Your toes might be dragging. You might have foot slap, which sounds like this. Can you ever hear yourself walking? Yeah, a bunch of people nodding. That's foot slap. It's a form of foot drop. So this exercise is going to be great for that. So what you're going to do, sitting in the middle or edge of your chair, and straighten your knees a bit, just so your feet are further away from you. And then with one leg, slowly lift your toes and forefoot up. Your heel stays down, but everything else lifts, and then lower. And then the same thing on the other side. And lower. Ooh, and you might feel some shakiness on that way down. But this is one of the best exercises. It's, again, should be hard, but this is one of the best exercises to strengthen the muscles on the front of your ankle that will help lift your foot so that you don't hear that slapping or you don't scuff your foot as much. The next one, and I'll give an extra disclaimer here, for the majority of my patients, the second part of this exercise is the hardest. So for this one, you're going to scoot all the way to your back of your chair, and you're still trying to sit up tall if you can. You're engaging your belly muscle, so you're just trying to tighten those a little bit. And step one is straightening your knee. Little pause here. This is strengthening the muscles on the top of your thigh. Now this is the doozy. Bend your knee. And if you have knee spasticity, this would be even harder. But even if you don't, it's still an exercise that is strengthening the back of your thigh. Okay, and then let's switch legs. Straighten. Just as straight as you can go. It doesn't have to be perfectly straight. And then bend and pull, 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 pull back as far as you can go. And then switch and do the other. Is this one hard? Okay, some say no. A lot of people saying yeah. So this exercise, you guys keep doing it if you can. I'm just going to stand up and demonstrate why this is a functional exercise. When we walk, we need to be able to bend our knee and straighten our knee. And if either of those two movements are challenging, it's going to affect your walking. So even though we're practicing it seated, that will help with walking. And you could do it standing. You could hold on to something and practice bending your knee and then lowering it. So there are other ways, but on the days where the temperature's throwing you off or the barometric pressure, seated is wonderful. Okay, sitting up tall and then relax. I don't have a good name for this one, so I just call it exactly what it is. This is great for core strength. So what you're going to do, you're sitting up nice and tall in the middle of your chair, belly muscles are engaged, and now just relax. Worst posture. Just fully relaxed, your core is turned off, and then sit up as tall as you can, and then relax. Now, if you're at the edge of your seat, that's a way to make it harder because when you relax, you've got even further to go to sit back up. So if you're like, this is really hard, then scoot back. If you're thinking, this is easy, I could do it for days, scoot yourself as far forward as you can. But such a great exercise. You could do this right now. Most of you are. As you're eating, you could do it. If you're working, if you're on your couch during a commercial break, and it's so good for our core. Okay, feel free to continue doing any of those. You probably won't because you might do them later instead. But these are some of the types of exercises that you want to be thinking about during these temperature changes, seasonal changes. If any of them feel too hard, the first thing that I mentioned for you to do was to have less movement, meaning just don't put as much effort in. Don't try to lift as high as you can. Instead, just try to lift a centimeter. That truly is enough. Another option, and a lot of people are surprised to hear this, is go faster. Going faster often is easier. And if you think about it, if I'm going slow, then it might take me a good solid 5 seconds to lift my leg and lower my leg. So in that case, my muscle had to work for 5 seconds. Whereas if I'm moving faster, it might not even be 1 second. So my muscle doesn't have to work as hard or as long. So going faster can be a great option. Changing positions. For that first exercise, that marching one, As I mentioned, this is the hardest version. So change positions. Maybe you recline backwards. For a lot of people with that specific exercise, the standing version is actually easier. And it has everything to do with our hip alignment. Your hips are straighter and then you're bending versus your hips are already bent and you're trying to bend further. So changing position, the majority of exercises can be done standing, sitting upright, reclined, lying down, lying on your side, some of them lying on your stomach. So just find a position that works for you. And then pick based on your energy, your stiffness, and your safety. As we all know, MS is so different every day, and for a lot of people, every hour. So just do a mental check-in. What can you do right now, even if that's different from what you did yesterday or a month ago, and focus on that. Being proactive, shorter bursts, often, if not always, outweigh longer sessions, especially for my fellow type A people. We feel like we need to exercise for at least 30 minutes or at least 45 minutes or an hour. MS research shows that exercising throughout the day is equally as effective as exercising in one chunk all at once. So on these days where it's hot or cold or it's a fluctuation, literally do 1 minute of exercise and then an hour later, another minute, and then maybe another minute. By the end of the day, you might have done 20 minutes of exercise. It's about the accumulation. Rest before you feel done. This is another biggie because for a lot of people, you don't know that you feel done until you feel it, until you feel like, okay, my body needs a break. In an ideal world, you would stop yourself before then, even if it's a regular temperature day, but especially on these days. Stack your most important movements early in the day. Again, earlier in the day, that barometric pressure is going to affect you less. Recovery and rest count as progress. Rest is productive. Your body will often work better if you allow it that rest. But as a society, we feel like rest is bad and we should not be resting. So often when I'm working with a patient who has MS and they tell me, I was doing so well, but now I'm at this plateau. I'll ask them, well, how many days a week are you exercising? My plan told them maybe 5 to 6 days. And they'll say, 7 days. I'm doing it every day. So my remedy is I have them stop for at least 1 day, and 9 times out of 10, they'll start seeing progress again. So that's an extreme example, but your body might do best exercising only 3 days a week. And if you're trying to push it to 4 days, 5 days, 6 days, you're not going to see the same results because that's too much for your body. So allow yourself that rest. Okay, so these are the warm-up. I love the warm-up exercises. They're ones we've already done today, but it's a different mindset and a different way of doing them. So these are the ones that I mentioned to do on cooler days because it can get your core temperature up. So this is what it looks like, and feel free to practice with me. So you're sitting in about the middle of the chair. A perfect time to do this is before you stand up when you're leaving today. So after you've been sitting for a while, if you're someone who feels stiff and like unbalanced, you go to stand up and you're like, I need a sec. Let me just stay here. Okay, now I'm ready. This can warm your neural pathways up so that you feel better quicker. So first one is marching. The first time we did this as an exercise, we went slow and steady. We lifted and lowered, and it looked a little something like this. But when we're thinking about it as a warm-up exercise, it looks like this. Doesn't matter how much movement, we're going much faster. The goal is just to wake up that neural pathway, wake up those muscles. Because as of right now, we've been exercising, but when you're listening to Dr. Gutman's talk, you might not be exercising. So for an hour or more, your muscles and neural pathways have essentially turned off. The light switch is down. All this is trying to do is turn that light switch back on. So just some quick marches, 10, 15 seconds. Then we move on to leg kicks. When we did this as an actual strengthening based exercise, we slowly straightened, we paused, we slowly bent, we paused, and then we switched sides. When we're warming up, it looks like this. So again, just much less movement, a little quicker. The goal, just get those muscles moving, get those neural pathways turned on. And lastly, ankle pumps. When we did this as a strengthening exercise, it was slowly up, slowly down, same thing on the other side. But when we're doing this as a warm-up, quick. Doesn't matter how much movement, just a little bit faster. So we're moving quicker, we're not worrying about the amount of movement, and maybe 10 seconds each. You don't need too long of a duration for this to turn on those neural pathways. So how do we implement this throughout your day? Because that's important. You can do these exercises here, but they're going to give you your biggest bang for your buck when you do them consistently. So number one, and this is going to be different for everyone based on what you're currently doing. If you're not exercising at all, or are you exercising most days? But generally speaking, if you need a basic starting point, pick one of the exercises that we did today. If you're a little bit more consistent, maybe you do all four. But at the very least, pick one and pick one time of day where you have the most energy. And that could be different every single day. So just checking in with yourself. At that time, you're going to do 10 good quality, slow and controlled, adding that pause movements just like we practiced today. And then when you're able to, maybe you do a second set, but maybe that's not for another week or 2 weeks. Or maybe you then add a different exercise. So you might start with your marching, but then you're going to do the knee bending. If you can, it can be easier to do these consistently when you associate them with something you already do. So several of you are having a nice salad right now and it's lunchtime. Maybe from here on out, you associate lunchtime with marching. And anytime you sit down to have lunch, you're just going to do 10 slow marches. The marches is a great one for after you've gone to the bathroom or sit to stands. I often have my patients, once they're done and clean and their pants are back up, I have them sit back down and then stand back up. And you're practicing this squat exercise right from the toilet because that's when you need the strength to be able to stand up from a lower surface. And aiming to do MS-specific exercises 3 to 6 days a week. It's going to be different for everyone. The MS Society and the Can Do MS, they often suggest 150 minutes a week of exercise. But remember, that can be done throughout the day or all at once. It can be whatever is possible for you. Remembering seasonal change, worsened symptoms from the heat or from the cold are valid, and it is real. It is harder to move. Your muscles are getting tighter because of the changes happening within your body. So it's valid to feel like those days are more challenging, but they're not permanent. Movement often helps, but so does smart movement and listening to your body, checking in with your body every single day. And there's always something that you can do, even if it looks different each day. My favorite one, if all else fails and you're like, I just can't today, either don't use that as a rest day, or that one that we practiced of just relax and then sit up tall. So just getting your mind to understand that if you want to, there is something that you can do. Don't just not exercise because you feel like, well, there's nothing I can do. Okay, so I'm open for questions. I'm excited. I love that you guys were actually practicing those. It looked like you were doing such a great job. If you did want any additional MS-specific resources, you can scan this QR code. My YouTube video is up there. My website, my podcast might be up there, so we can connect over there.
Let's give Gretchen a round of applause. Thank you. So Gretchen does a tremendous amount of things on the internet. And if you haven't seen her, it's really something that you should check out. All right, she's helping thousands of people around the world, and I hope you have some questions to ask too. Who wants to start first? Who's going to be the brave one? Stick up your hand and say, I have a question. All right, so none of you do, but there is somebody online that said that they have one. So let's check that one out. All right, person wants to know, need to get closer, no glasses. Person wants to know what they do to best get around in snow when they feel they need to get outside to exercise.
So snow,
How to walk better in the snow.
Yeah, so this could also be true for the summertime if you are going to be ever in a situation where you're walking on grass or cobblestone, gravel. So anytime you're going to be walking on an uneven surface, you are going to want to do two things. Number one is the functional strengthening exercises to improve walking, which we'll review. We've already done some of those. But the other is practicing those movements on uneven surfaces. What that does is the actual exercises get your muscles stronger. But time and time again, I have my patients doing those and they get really great strength. And in their home, they walk great. But as soon as they get outside on the snow, grass, sand, whatever it might be, those muscles don't work. So practicing something, those same exercises or even just walking on those uneven surfaces, it's more about getting your brain on the same page as your muscles. If your brain freaks out, if your brain sees snow and you're like, I haven't walked on snow in years, even if your muscles are super strong, our brains always win. So we got to get our brains more comfortable being on uneven surfaces. So given that right now is June, for this person who wants to walk better on snow, even though it's summer, get outside now and practice walking on uneven surfaces. Snow is uneven, but it's also wet, and that can make things slippery. There are things that you can put on the bottom of your shoes. The brand I'm aware of, I think they're called Yak Tracks, but they're like little spikes on the bottom of your shoes. I would recommend wearing those. But the exercises that you can do in your home and on uneven surfaces, one is what I demonstrated very first, is the weight shifting, staggered stance. If you have difficulty weight shifting, walking, I can guarantee it will be hard for you because we need to be able to shift our weight forward in order to do the rest. And if we can't shift our weight forward, you've got too much weight back here, you're going to be having a backward propulsion. So this is one of the best exercises. The marching exercise, seated, standing, lying down, any of those variations. The knee bending exercise, again, seated, standing, whatever variation. The toe lifts, because walking requires 7 things. Shifting your weight forward, bending your knee, lifting your foot, bringing your knee up, straightening your knee, putting your heel down first. And all while that was happening, I was standing on one leg. Even if you're using a mobility aid, you're still standing on one leg. That's 7 things. So each of those movements should be an exercise that you practice in some capacity. So what that looks like is just repeating it. Shift your weight again and again, march again and again.
Thank you.
What would you suggest using in the home to make the surface uneven?
Ooh, great question. It depends on your current level of balance. So it's going to be a little bit different for everyone, but pillows could be a great option, especially thinner or less fluffy pillows at first, because when you stand on it, you might even still feel the ground because there's just not a whole lot there. But the squishier and the higher the pillow, that's going to be for sure a little bit wobbly. Or you could actually keep the ground the same, but make yourself an obstacle course in your home. So what that might look like is maybe you've got a pillow that you either step on and then off, or maybe you step over it. Then maybe you put a book and you have to step over it this way. And that's just real life training. When we're walking, sometimes there's something in front of us that we have to step over. And again, practicing that not only strengthens your muscles, but it does a whole lot of great for your mind because your mind is seeing it and understanding, okay, I've got this. I've done this before. But a pillow is one of my favorite things. There's something in the physical therapy clinic that's called the AIREX, AIREX. It's basically a foam pad. You could just get foam from anywhere, but standing on a foam pad, and they have different thicknesses. So based on the thickness, it'd be easier or harder. Those are usually my two favorite options.
Thank you for that. Now, for anybody doing that, though, if they have balance issues to begin with, shouldn't they have a chair or something nearby to grab onto?
Yes, in my mind, as I was demonstrating those and saying those, I was actually envisioning a mobility aid. So you can still practice balance on uneven surfaces while holding onto your rollator or trekking poles or a cane. So if you normally use a mobility aid, use it when you exercise. The goal there, whether it's a mobility aid or, as Stuart mentioned, a chair that won't tip over or a countertop, the goal is to use it as lightly as possible. I want you to picture body weight scales, like you step on, it tells you how much you weigh. Miniature versions, I want someone to create this one day. Miniature versions that fit in your palm and have in your mind, that tells you the percentage of how much body weight you're putting through that hand, and you'd have one on both hands. How much weight would it say? What percentage of your body weight would it say as you're holding onto your rollator? If it's 50% or more, you're actually putting yourself at risk of depending on it too much, not working your way off of it, sliding if it's slippery outside. So especially as you're exercising, picture, I want to put 10% of my weight or 20%, whatever it is, through the chair, the rollator, the trekking poles, the countertop, whatever it is.
Thank you. Are you familiar with the visible arm band that assesses energy levels? And if so, your thoughts?
Oh, I just recently heard of this. I haven't tried it and I don't know anyone who has used it. So unfortunately, I can't really speak to that, but I did just recently hear of this. Yeah.
Okay, so while I make my way out there, though, do you want to speak to them about the psionic sleeve?
Oh, sure. So are you guys familiar of the general concept of electrical stimulation? There's products like the Walk Aid, the Biogen, Psionic Neural Sleeve. These are devices that you put somewhere. There's specific places, but we're talking about quite a few. You put them somewhere on your leg and they can help you. Most of them help with foot drops. So the goal is that it activates it kind of feels like bees stinging you, but it activates your nerves that lift your ankle. So it can help with foot drop. There's a newer one called the Psionic Neural Sleeve. And I actually am a big fan of that one because it's a sleeve. And especially if you're short, it's going to fit basically the full length of your body. But it's a sleeve that you put on up near your upper thigh, and then it goes all the way down closer to your ankle. And you just wrap it on. It goes under shorts or pants, and there's electrodes on it that stimulate nerves that can help you with bending your knee, straightening your knee, and lifting your ankle. You can turn some of them on or all of them on. You can turn them all off if you don't want to use them all the time. So that's the first one on the market, at least that I'm aware of, that can target multiple areas, which is great because a lot of the times the other ones are just foot drop. But what if you have foot drop and bending your knee is hard? It's really just helping with one of those.
Thank you.
So my question isn't too detailed or anything, but it's about the Q&A, scan for resources, free content, and ways to connect. My phone doesn't scan that. So what is the website?
The website that has all of these would be missinglink.com. So MSING link.
I have a question because I'm at the age now where I'm starting to be concerned about my bone density. So I do want to do some type of weight training, but every time I go to the gym, and I've gone to 2 trainers and I've explained to them I have MS, they overheat me each time. Should I go to a PT that's an MS? Because even though I tell them the repetition, I'm getting overheated, I pretty much get done. And after that happens, I'm done for a couple days, like when I get overheated like that. So how would you recommend going different way.
Such a good question and such a frequent experience that a lot of people go through, unfortunately. So there's one of two ways. Obviously, I think the best situation for you, because it takes the work off of your plate, is to go someone who is quote unquote MS aware. Ideally, it'd be a physical therapist who is also an MS specialist. If you're looking at PT clinics around, the letters that you're looking for after the name is MSCS, multiple sclerosis certified specialist. Unfortunately, we are few and far between. So I think the next best thing would be but two things. Number one, and this isn't what you should have to do, but unfortunately it's pretty common, you have to educate them and advocate for yourself. So when you're exercising, tell them, I am done after 2 exercises or whatever it is you feel like you might be able to do without overheating, and say, I'm going to take a 5-minute break. You can go do what you want. I'm still paying you for the full hour, whatever it is. Like, I'm stopping now, and really stick to that. So that can be really important. And it might take you a while to know that answer though. You might feel fine during it, and then you don't know that you're done for a few days until the very end where you're like, well, that was too much. So as you're exercising, really taking a time to think of what number of exercises can I do before I overheat? Or how many minutes can I move before I start to overheat? But then the other side of things is, I mentioned the cooling vest earlier. Wear that on you as you're going to this session, having ice cold water on you. Like, I used to train for half marathons and I wore one. It was a very lightweight one and I wore it around my arm up here. Wear that so that you can easily, as they're explaining the next exercise, you grab and you have a sip of water. So trying to use some of those strategies as well as advocating for yourself. A lot of people, a lot of personal trainers who are not MS aware might even say like, oh, okay, I gotcha, heat intolerance, or you get overheated. Okay. But they don't really know MS and how that affects you and when to stop. So educating them, but really sticking to your guns and just stopping when you need to, which I don't like that answer. It shouldn't be up to you, you know? Right.
I was in my 30s, but I don't think she was a new trainer. And I told her, and she's like, oh, I have MS too. And I'm like, okay, it didn't work. Yeah.
Well, and another thing too, and this might be dependent per situation, but asking, like, let's say your session's an hour, maybe even asking, can it be an hour and a half? So that we build in rest time, because their mind might be thinking, okay, she's with me for an hour. We got to go for the full hour, even though that's not going to be what's best for your body. Or maybe just 30 minutes, but still include that rest time and those water breaks.
Thank you. Next one.
Do you know of any local free MS specific exercise classes in the area?
Local, free, MS specific. I'm not aware of any local in person. Dr. Gutman, do you know of any?
Okay, so the previous programs that was at the Bennett Institute to have groups of patients that may come in and exercise there with no payment or very small amount monthly. There's no more real. There are some in video performed, and there are some changes over there also on personnel, so they may restart.
I will follow up and see what the status and encourage them to look at this.
Thank you very much.
The only other thing I can think of, and this wouldn't be in person, but there are MS specific classes online. So for example, on my YouTube page, I've got several different exercise classes. It is up, obviously there's some downsides to that. It's not in person. So I can't say, oh, make sure you turn your leg this way or do this or that. But if you're unable to get to an in-person, or if what you're looking for isn't available in person, there are some good resources online for MS-specific exercise classes.
Okay, thank you. Next one online is So how do I improve my spasticity when it's hot outside, but I'm already inside in air conditioning? I actually get chills and hands and feet are cold, definitely not feeling hot.
So this is going to be different for each person, but what you could try, if you're feeling cold, my first question is, could this actually be cold intolerance, even though it's summer outside? So for some people, when it's hot outside, you're in air conditioning and you're still affected because of the barometric pressure and it's still hot outside. But for other people, if you also have cold intolerance, and maybe cold intolerance is new for you, but if you also have cold intolerance, then inside in air conditioning might be too cold for you. Either way, it can make those symptoms worse. And either way, one of the best strategies to improve the symptom that's worsening is to change your core temperature. So it could be possible that if you're too cold and you're inside in air conditioning, turn the air conditioning off, or just so it's not as low, or keep it on, but be sipping warm water or warm fluids and put a little sweatshirt on. Maybe depending on the heat and humidity, you could step outside. And I'd be curious if that helped at all. If that didn't help, then it's also different to cool your core temperature internally by sipping cold water rather than externally with air hitting you. So I would try some different strategies. It's going to be trial and error and just see what works for you.
When is the time to do regular orthopedic exercise for muscle strengthening? When is the best time?
So the way that I like to think about when to do MS specific, the question was, when is the best time to do the regular or traditional exercises? I like to think of it as, what is your goal? If your goal is, I just want to get stronger overall, I just want better balance overall, that's when those traditional exercises it'd be a great time for those ones. But if you ever have a goal of, I want better balance so that getting dressed is easier and I don't feel like I'm going to fall over, that's more functional MS specific. If your goal is, I want to climb stairs and bend my knee more so I'm not scuffing my toe with every step, that's functional MS specific. So it really depends on what your goals are. At the end of the day, any exercise is better than no exercise. So if you're getting confused or overwhelmed of, I don't know, just do anything. Don't make it too hard on yourself. But that's how I would determine which type of exercise you should be focusing on.
People were asking about specific core temperature. Is there a way for them to know when their body has reached a specific temperature and that they should stop or slow down?
So the question was, is there a way to know what your specific core temperature is and when to stop or slow down? It's going to be different for everyone, which I always hate that answer, but I don't know of how you would test specifically for your core temperature. Like, I don't know if a regular thermometer would work for that, but even so, it would be different for everyone. Again, some people, if your core temperature rises by 1 degree, you're going to notice a ton of flares. For other people, it might be 3 degrees. And I do actually have patients who know exactly what degree it needs to increase by for their symptoms to worsen, but it is different for everyone. I'm trying to think of like a device. Does anyone know of a device, or do you use one to test your core temperature? Looks like no.
A huge part of the physical therapy was my therapist teaching me when to take that break, recognizing the signs and not trying to push through. So is there a way that therapists can be, is there a place that physical therapists that don't know much about MS to go and listen to you? And is there a way for you to reach out to these people?
So I did actually, this is so common where there are very few physical therapists that are MS specialists. So I did actually create a course for physical therapists. It could be for anyone, but it was designed for other therapists to learn these things and exactly what does it mean and exactly how does it impact people with MS? Because a regular physical therapist might hear heat intolerance and say, okay, got it. Make sure they don't get too hot. But as you all know, it's so much more than that. And being proactive and asking the right questions is key. So the training for physical therapists, if you're working with the one who doesn't know MS, it's called the MS Therapist Toolkit. I got certified through the CMSC, the Consortium of Multiple Sclerosis Centers. So if they wanted to get certified, that's where I went through.
Okay, let's thank Gretchen for joining us today.
Thanks for having me, and thanks for participating, especially during lunch.
Thank you so much. All right, I want you all to have a very safe day, and thank you for coming. And everybody online, thank you as well. Bye-bye.